guys, I'm Dr. Jeff Davenport with One Focus Medical. It's been a long time since I've talked to you guys, but we need to get some information out. We're going to be doing some episodes in the future. Hopefully you guys get some benefit out of it. Well, one of the things I want to talk about over the last 6 months that's really kind of blown up, in my opinion, because it probably wasn't vetted well enough to begin with, although I wasn't involved in that process, so I'm not trying to insult anybody. But the health information exchange, to all of my patients, I had emailed you more than once about this state law. It went into effect a couple of years ago, actually. It was passed, I think, not in 2022. I think it was even 2021. We found out at one point that it was actually part of the involvement of taking the Medicaid expansion from the federal government. As part of that Medicaid expansion, some kind of health data informatics exchange system has to be set up, has to be monitored or at least facilitated by the government to accept those federal dollars. Whether any of that is right or wrong, we could argue all day long. It's politics. Everyone's going to have an opinion on that. However, the health informatics entities that do these types of things, they've actually been out there for a long time. I think the entity that was going to be a part of this law have been in business since maybe 2011 or 2009. So they've already been around for a long time. Many providers across the state, hospitals, emergency rooms, all of the different entities throughout the state, many of them already share health information with this type of a private business. It is a private business. It's a not-for-profit organization. It's not state facilitated. It's just there's a state administration that oversees it as part of the law. But anyway, this law passed, and then here we are a year or two later, and they began to implement it. And part of the problem is the law gives the state entity, the Oklahoma Healthcare Authority, basically the authority to implement the law, but it didn't really give much direction, or at least not very specific direction on how to implement it. And so the Healthcare Authority drew up their own rules and then began to implement this process. And as you know, as every politician in the state knows, as many of my patients know, things just kind of blew up because not very many of us knew all the details of it. So at any rate, once I found out that my practice, as with every single other practice in the state, was going to be compelled to communicate with some health information data system at a proposed possible penalty, financial penalty, for not doing so, I felt that went against my oath as a physician to protect the patient's privacy. I think the patient's decision on this type of thing has to be paramount. There are patients in my practice who think it might be a good idea. There are patients in my practice who don't want their information shared with anybody. And so because of who I am and because of who all of you are, I did everything I could to begin to fight this process. And I wasn't alone in that. Many physicians, many counselors, providers, healthcare workers across the state rose up. Many politicians rose up, and at some point, the governor actually denied the rule recommendations by the Healthcare Authority. And that happened, I think, June 23rd, as I was just brushing up on an article on it. And so the health information exchange currently is not going into effect. So we're all off the hook for a period of time. I just got done reading the newest proposed rules that have changed drastically, that are proposed to, or they're going to be passed coming up this week, July 14th, I think it said, and today is July 12th. So this Friday, the rules are going to be either proposed or passed or evaluated. And the cool thing is that they've drastically changed the rules, and at this point, the rules basically state any physician who requests an exemption will receive it. There's not even any really qualifying criteria. There's not a financial hardship recommendation. There's not a, well, I'm a psychiatrist and my notes are very sensitive requirement. There's not, I'm too small or I'm too big. It's just, if Jeff Davenport, MD, requests an exemption, then my practice will not have to or be compelled to participate in the program. It obviously allows me to if I desire to. I think in our practice we probably won't. There are certainly some financial considerations involved there. But first and foremost for me, I really just want my patients to have the opportunity to choose who and where they send their records to. Just so you know, anytime you want your record, I can email it to you within minutes, your entire record. It's not hard to get you a copy of your record so that you can disseminate it wherever you think is appropriate, whether it's your cardiologist or whether it's a new doctor that you're going to, or to some health information system. And so getting you your information, getting you your record in a handy dandy digital format is a piece of cake. But I don't just want to upload everyone's information every single day, every single time I see somebody, every prescription, et cetera, I don't want to just upload that automatically, which is the way it would essentially be done. So at least for my practice, I probably won't participate in this system. And so I'm hopeful that the rules will get passed at this point as written, because it allows those types of things. Just a couple of teaching points for my patients. Remember, I'm only talking about my practice. There are other entities out there, whether it be hospital systems, emergency rooms, urgent cares, your specialists, especially employed physicians are probably going to be more likely, being a part of a large network, being a part of a large entity, being employed by a large system. All of those facilities are likely going to be tied in to the health information exchange. Now, once again, some of us may think that's good. Some of us may think that's bad. But if you have a concern for that, if you're not sure you want your data uploaded into a system like this, I think it's going to be incumbent upon yourself every time you see a provider to ask that question and to opt out, because there is a provision to opt out, at least with respect to any provider's individual policy. I suppose there may even be providers that their policy is that here in this office you don't get to opt out. Well, that may be their policy, and you as a patient may then choose to say, okay, well, I want my stuff to remain private, and if you're not going to allow me to do so, then I'll go find another doctor who will. And that of course would be perfectly appropriate. As the patient, you should be able to make those decisions. But I think most offices, even the ones that are employed or parts of big systems, would have some kind of a policy where a patient could opt out. But once again, that's just something you'll have to vet with each and every visit to a healthcare provider in the state. But at any rate, I personally think this is a great victory over the last month or two or three. It seems like it was a whirlwind. Us going to the Capitol and talking to different politicians, et cetera, et cetera. And once again, we weren't the only ones. There were large groups across the state, Facebook groups popping up left and right. There were even a couple of lawsuits, I believe, that were filed. But thankfully, the government entity listened, and I have to give them credit. Maybe a lot of this wasn't vetted out early on. I don't know. I'm not trying to place blame anywhere, but once the healthcare providers across the state really started sharing their opinion, as well as patients, then we were able to get some serious changes made. And so I'm very excited about that. I just wanted to give you guys the heads up, and hopefully we'll talk to you again about something way more fun and way more interesting and way more beneficial for you in the future. This is Dr. Davenport. I'll see you all next time.